So are you suffering from ongoing shoulder pain? Have you seen your orthopedic surgeon and told you you need to have surgery? There are better options. There are alternatives that can successfully treat your shoulder problem without having to undergo surgery. So if you are suffering from chronic shoulder pain and it's impacting your quality of your life, please come to see us to look for alternatives to help to improve your function. Hi, I'm Dr. Adelsheimer with Regenexx Pittsburgh, Southwestern Pennsylvania's premier provider of interventional orthopedics and orthobiologic procedures. Should I have rotator cuff surgery? So you've injured your rotator cuff, you've gone to your orthopedic surgeon and he's recommending surgery to repair this problem. Is this your only option? The answer is no. You should seek an alternative solution to this problem. Depending on the degree and the severity of the injury, there are very good alternatives to orthopedic surgery. So before you opt to go under the knife and have an extensive surgery in a hospital that has significant risk, including infection and other problems that can result from surgery, come to see us to look for alternatives. In addition, surgical treatment for the problem will lead to significant amount of downtime. After surgery, you will be laid up for a period of 3 months. Then you will start therapy and will barely get back to your normal activities after 6 months. Whereas with a orthobiologic procedure, you can get back to normal activities right away and improve dramatically within 3 months. So there is minimal downtime and significant improvement without having to undergo major surgery. So rotator cuff injuries are very common problems for two distinct classes of individuals. Number one are athletes. Any athlete who is doing any type of overhead activity, be it a baseball player, basketball, tennis, anything that involves using your shoulder very significantly increases your risk to develop a tear in the rotator cuff or rotator cuff tendinitis. The other common people who develop rotator cuff problems are the elderly. As we get older, our rotator cuffs become thinner and more friable and therefore much more susceptible to developing what we call microscopic or chronic tears in them. Also, another group that is susceptible to rotator cuff problems are workers who have to do overhead activities. So construction workers or even airline flight attendants who have to lift into the overhead compartment often have rotator cuff problems. You should see your doctor if you have pain in your shoulder that's lasting more than a week. If you just had a simple strain sprain injury and it gets better within a week by just resting it, taking some anti-inflammatory medication, then you don't necessarily need to see your doctor. However, if this is persisting for more than a week and you have any difficulty in raising your arm overhead, you should definitely see your doctor for an evaluation. So you injured your shoulder, you've gone to see your regular physician who ordered some x-rays, then he sent you to an orthopedic surgeon who told you have torn your rotator cuff. Now you're deciding whether or not to have surgery or to look at alternative options. We have great options for you by using your own cells to try to heal your own problem. Interventional orthopedics and orthobiologic solutions can be the answer to help solve your problem. So stay tuned and please join me in my next video where I get into detail on how orthobiologics and interventional orthopedics can help solve your rotator cuff problem without having to undergo surgery.